140 organisations around the world are working on a vaccine and collaborating with one another. And every day we're getting closer to finding one.
And it's very promising to start with.
A handful of them have even reached the point where they're testing the vaccine on thousands of humans, something called a phase 3 trial.
Not quite popping the Prosecco just yet.
A lot has to happen before we can know that a vaccine works and that it's safe. What exactly is a vaccine? Well, it's like a training course for our body's immune systems. They harmlessly show viruses or bacteria to our bodies. Our immune systems recognise them as an invader and learn how to fight them. It means that next time, when we encounter the disease for real, our bodies already know how to handle it. There's a lot we don't understand about COVID-19, but we know its genetic code. Some scientists are lifting parts of this code and combining it with existing viruses to create something that looks like the coronavirus. This can then be given to animals or humans. Others are injecting pieces of raw genetic code, such as DNA, straight into test subjects. Whichever approach is used, when researchers think they've found something that works, it has to be tested again and again and again, and go through so many clinical trials to make sure that it's effective and that there are no unintended side effects. And even after that, it still needs to be approved by medical regulators. The reality is that most of the vaccines being trialled right now will fail. When can you get the vaccine? Well, most scientists seem to think it'll be the second half of 2021 at the earliest. And that might seem far away to you, but vaccines usually take years, if not decades, to develop. And then you've got to make this vaccine on a massive scale. Some countries, such as the UK and the USA, are already spending money to secure vaccines for their own populations. But the World Health Organization is also taking steps to try and ensure that all countries have equal access to a vaccine, no matter who discovers it or how much money a country is willing to offer for it. The plan is for healthcare workers to get vaccinated first, then 20% of each country's population will be given the vaccine. The idea is to have vaccinated 2 billion people by the end of 2021.